Well, good day and welcome everyone to Cochrane Canada Live, the research webinar series brought to you by the Canadian Cochrane Centre. My name is Adrienne Stevens. I hope you're having a great day. Before we get started with today's session, I just want to take a moment to thank the funders of Cochrane Canada, those being the Canadian Institutes of Health Research, in particular the Knowledge Synthesis and Exchange Branch into 7 of their entities. Thank you to CIHR. I would also like to highlight the Pan American Health Organization, that is the regional office of the WHO for the Americas, to the Research Promotion and Development Division for providing Illuminate Live to us to be able to conduct webinars such as the ones today. Thank you to PAHO for your partnership and support. And I just want to remind you some of the features that we have on Illuminate. So when you're participating today and you want to sort of use some of these items that you're aware of where they are. So just to start off here, if you wish to ask a question, and today's speaker panel have set aside particular times at which they are willing to take questions, you simply need to click on this button. And that will just prompt them to let them know that you are asking a question, and a queue will form in the participant window. If you wish to send some emoticons through, or send a happy face, maybe send some applause, these are the items that you can use here. And one of the interactive features of today's webinar, we're going to be doing some polling. And so when the speakers put up their slide to ask you a question and wish you to participate in a poll, all you need to do is make one of these selections here. And I just want to note for you that when you make your selection, you won't see it appear in the participant window, but it will be registered by the system. So you just need to click once, and then at some point then we will publish the aggregate results to the whiteboard. And if you are joining today without a microphone, or if you wish not to use your microphone, then you can simply add any questions or comments here to the chat room. And as you will note, the settings are such right now that all of the questions and comments are directed solely to the speaker panel, but there will be a point in the session where we can open it up for some discussion, and at that time you will be able to see each other's comments. And just to remind you of the format of the webinar, so it's one audio activated at a time. And if you do wish to use your microphone and raise your hand, and the speaker has instructed you to go ahead and ask your question, then all you simply need to do is at the bottom left-hand corner of your screen, you will see this button. So you just click on it, ask your question, and then I just remind you to click on the button again. That releases your audio and allows the speaker to answer your question. And so I just wanted to highlight the 2 groups that the speakers are joining us from today. One is the Cochrane Child Health Field, and I've added their website here on the screen, and we're happy to provide that as well to you afterwards, and as well to the Cochrane Comparing Multiple Interventions Methods groups. So if you wish to know more about them or get involved, please check out their websites. And without further ado, I would like to introduce today's speaker panel, starting with Denise Thompson. She holds an MBA and also an MBA with a specialization in knowledge transfer in healthcare. She is the administrator of the Cochrane Child Health Field and managing editor of the field's journal, Evidence-Based Child Health, a Cochrane Review Journal. In this capacity, she oversees the production of the field's overviews of reviews. She is chair of the Cochrane Field's executive and has recently been elected to serve on the Cochrane Collaboration Steering Group. Congratulations, Denise. To introduce Dr. Lauren Becker, he is Professor Emeritus at Upstate Medical University in Syracuse, New York, and has spent his career practicing and teaching family medicine at a number of medical schools in Canada and the U.S. He served as Chief of Family Medicine at the Toronto Hospital and also as Chair of the Department of Family Medicine at Upstate Medical University prior to his retirement. A longtime Cochrane author, and having served in various leadership roles in the collaboration, including co-chair at the steering group, He is currently a member of the editorial board of Evidence-Based Child Health and is a co-convener of the Cochrane Comparing Multiple Interventions Methods Group. And Michelle Foisey, she has an undergraduate honors degree and is a research assistant with the Cochrane Child Health field. Her main role involves coordinating and conducting overviews of reviews for the journal Evidence-Based Child Health, a Cochrane Review journal. And so as I turn things over to Denise, please join me in welcoming them here today.
Okay, good morning everyone, or good afternoon, or good evening, depending on where you're joining from. This is Denise Thompson, and I'll just give a very brief introduction to today's talk. Thanks very much for joining in. I hope you learn a lot, and we're looking forward to the discussion and questions that we get from you today. So the topic of today's webinar is a primer to Cochrane overviews of reviews. So we're going to cover quite a bit around the logistics and the work that goes into producing an overview of reviews. So I'll start off with a very brief introduction to overviews. But what I'd like to do first is check in with all of you who are joining us today and check how many of you have completed an overview of reviews. So this is your chance to get acquainted with the voting feature on the webinar. Oops, jumping ahead. So if you can just use the check or the X, and I'll give you a few seconds here. Things are populating here as all of you vote. Okay, just a second or two more. Okay, is everybody seeing the check and the X, the little box in the top left-hand corner of your screen underneath where the participants are listed? It's just on the right-hand side there. Okay, looks like most of you have found that. So, of those of you who have replied, very few of you have done an overview. Most of you have not, and so that's really helpful for us to know as we go through our content for today. Thank you. So what we're going to do, we have 3 speakers and 3 sections in today's talk. I'll very briefly talk about the child health field and our experience with the overviews that we've commissioned over the last several years. And Lauren will talk about what is an overview, and then Michelle will give you probably what you're all here for, which is how do you actually do them. And I think my slide, there we go. So overviews used to be called umbrella reviews, and I still find that term really helpful for explaining to people what we're talking about. Basically, an overview or an umbrella review is a synthesis of information from several systematic reviews, and the point of an overview is to be a friendly introduction, a friendly front end to the evidence from systematic reviews. So if you have a particular clinical question, rather than trying to read several systematic reviews and figure out from that, okay, what do I do here? The overview is crafted to give you that one answer, or the information about what's best. And Lauren and Michelle will certainly go into that in more detail. So the overviews that the child health field commissions, they're commissioned manuscripts. We do 6 a year. They're published in our journal, Evidence-Based Child Health, and they're produced by interdisciplinary teams, so very similar to systematic reviews that require the expertise of many people. They follow the format laid out in Chapter 22 of the Cochrane Handbook, so in that way they're similar to those that are published on the overviews that are published on the Cochrane database of systematic reviews. And because we are the child health field, our overviews are about kids, so infants, children, and youth. Okay, so in doing an overview, my slides keep bouncing around. The ideal situation for doing an overview is that you have all the reviews that you need, all the systematic reviews that you need that cover all of the relevant interventions for a condition, and those reviews are completely up to date. And you have overview authors who are world experts in their field, but who have nothing but time for doing the overview. Well, the reality that we've found over the last 5 or 6 years that we've been doing these, and we've now produced 21, so we've learned quite a bit. The range of reviews is often incomplete. Sometimes updates are in progress or protocols are in progress. They're not quite ready yet. And sometimes important interventions are not covered by a systematic review. And we've worked with many, many groups of overview authors. They're always keen and wonderful people, but they always have limited time. So we're always managing the overviews with those constraints. That being said, there's a clear demand for our overviews. When we look at our download statistics for evidence-based child health, which started publication in 2006, as you'll see in this graph, and we analyze the percentage of downloads of our overviews versus the downloads of all the other content, I mean, you can see here that the overviews are clearly the most popular part of the journal. And so we know that there's a demand and an interest for this type of synthesis. Okay, so that's it for my very brief introduction. And I'll just stop here and see if any of you have any questions. Otherwise, I'll hand things over to Lauren. And you can indicate a question by either putting your hand up or typing something in the text box. Okay, I think I'll hand things over to Lauren now. Go ahead, please, Lauren.
Okay, thanks, Denise, and thanks to all of you who are tuned in to this webinar. My task is to tell you what an overview of reviews is, and as Denise mentioned, there's a chapter in the handbook that you could read to find this out, but in fact, it's already outdated because we've had a meeting recently of the new methods group with a number of other people from the collaboration to have another look at overviews, and we've made some changes. So I want to give you a quick overview of those changes, and I'll be putting some documentation of this up on our website fairly shortly, so you'll be able to have a look at it there. We decided overviews have 4 essential features. They address a well-defined clinical question, they compare 2 or more interventions, they use a search strategy that focuses on reviews rather than on trials, and they provide a synthesis or integration across the existing reviews. So to move on to look at each of these in a little bit more detail, what about the well-defined clinical question? We encourage overview authors to try to put themselves in the shoes of a decision maker who has to decide about which among a number of competing interventions would be the best one to use. So it's very important to get the population, the clinical scenario correct, and it's important to specify the kinds of interventions that would be looked at, and we'll be talking about outcomes a little bit later. One of the questions that's worth asking at this point is, would it be reasonable to compare these interventions in different arms of a single randomized trial? And it turns out that's an important assumption for some of the statistical analyses that can be done with overviews. But in fact, it's a good rule of thumb to use in looking at the interventions for an overview, even if you're not planning on doing complex statistical analyses. Overviews compare 2 or more interventions, but clearly that's not the only way you can do it. There are a lot of Cochrane intervention reviews out there that compare 2 or more interventions, and so we'll be looking at what are the differences and how might you choose when you want to compare interventions using an overview or using an intervention review. And there are 2 key differences between overviews and intervention reviews. As I've mentioned, the important one is the search strategy, which is always different between the 2. Intervention reviews search for individual trials, where the strategy in overviews is to search for reviews and use those as pointers to the trials. There's sometimes a difference in the analysis, but not always. Intervention reviews, again, go at this from a trial level. In overviews, it may be possible to do the analysis from a review level. That is, use the summary statistics from the reviews and combine them rather than going back to the trials. But in fact, it's often important to go back to the trials for this as well. So the search strategy, as I've said, is to focus on finding reviews, use that to point to the trials, but sometimes you need to extend the search. Some overviews go beyond Cochrane reviews and look at non-Cochrane reviews as well. Sometimes the reviews you find are not up to date, and the search needs to fill in the time from the last search and review to the present. Sometimes not all the interventions are covered, and so there needs to be a focused search for trials to supplement the trials found by looking at the reviews. On the analysis level, we were fortunate with the very first overview that we published in Evidence-Based Child Health that it actually was possible to do the analysis using only the data from the reviews without going to the individual trials. So the subject was bedwetting in children, and the various interventions are connected here. The lines of connection indicate which of these interventions are being compared with which interventions. You have placebo, you have 3 different kinds of drugs that are indicated with the blue ovals, and you have 3 different kinds of behavioral interventions that are indicated with the green boxes. It wasn't done in the Evidence-Based Child Health overview, but in the reference I put here in a further study, Debbie Caldwell was able to do both direct and indirect comparisons in a fairly sophisticated way using just the data that was available in the reviews without going back to the individual trials. Unfortunately, that's not always the case, and it may be the case in the minority of times. Very often there are reasons that overview authors need to go back and dig out data from the individual trials. The review question may be different than the overview question. Sometimes populations are different, the outcomes are different, or the measure used to estimate effect may be different. And the reviews may not contain all the trials, so it may be necessary to combine in trials. So overviews should synthesize or integrate rather than just going through the reviews one at a time and describing them individually. That is, the authors need to step back and go back to their well-defined question from the beginning and see how best to address that rather than getting diverted onto the questions that were raised by the individual reviews. And this is where the outcomes become extremely important. We suggest that authors look at outcomes and specify at the protocol stage or at the beginning stage what outcomes they're most interested in looking at. Those won't always be available even in the trials, but sometimes they're not available in the reviews, even though they're available in the individual trials. And this, again, is a reason for going back and doing a trial-level analysis. And I just want to show you one example of an overview that's about to be published in the Cochrane Library. I think it's still in protocol stage, but I think the authors did a nice job of taking a complicated area and using the overview to provide a nice synthesis that wasn't really provided in any of the reviews that went beyond what was provided in the reviews that they found. So the question was whether financial incentives change the behavior of healthcare professionals and secondarily change patient outcomes. And they identified 2 Cochrane reviews and 2 non-Cochrane reviews. And the authors of the overview came up with their own classification of what's an incentive and what types of incentives there are, from fairly simple ones like just paying a salary to fairly complex ones like rewarding people for a given level of quality of care or a given type of activity. So before starting the overview, they had their classification, and they had also their classification of outcomes, and they found this set of outcomes in the reviews that they could use. But so then their plan was to put together this grid with the outcomes across the top and the interventions along the side, and to be able to make some comments about the effects, relative effects of each of these interventions on each of these outcomes. Unfortunately, when it got to looking at the reviews, things were kind of scattered. So this is which boxes were filled in by the trials found in one of the 4 reviews, and you can see they're kind of all over the map. And it gets worse if you try to compare that with the second of the reviews, where these 2 boxes overlap on the left, but the one on the right is totally different. So if they had gone about this by trying to describe this on a review-by-review basis, they would have been bopping all over their graph and making things very confusing for the reader, and then having to do the same thing with retracing some of their steps with the next review. However, what they were able to do was pull out the trials from the reviews and align the trials on their graph, and then they were able to make some coherent comments and comparisons about the various interventions. So, when do you do an overview versus an intervention review? Well, overviews can be much less resource intensive. There's an easier search. There may be an easier analysis, but they really depend on the availability of good reviews in the relevant areas. And sometimes it might actually be easier just to start with an intervention review rather than doing an overview. So what we're suggesting is that people should consider the overview as part of a process, with a protocol that specifies clearly what the question is, and the overview as a first step. In some cases, the overview will nicely address the question, and it may not be necessary to go any further. In other cases, it may not, but in that case, it's provided some useful information that can be used in designing an intervention review. And the trade-off in going to the intervention review is whether the resources allow it and whether the answer gotten from the overview was good enough to make it unnecessary. And I'm now open for questions. Okay, don't see any. I'll turn it over to Michelle.
Okay, so now that Denise and Lauren have talked about what overviews are, why they're important, and when you should conduct one, I'm going to switch gears a little bit and talk about the methodology. So, how do you actually conduct an overview? I'm just going to wait for my slide to switch over here. Okay, so the steps to conducting an overview are fairly similar to systematic reviews. I'm going to talk briefly about issues related to the scope, the search strategy, and screening and inclusion. And then I'm going to talk more in depth about issues related to data extraction. So for the scope, what the child health field does is we choose a general topic before we contact potential authors who are experts on the topic and who know the field well. The clinicians then refine the scope based on their expertise, and this generally requires the clinicians to pre-specify the PAHO, so the population intervention comparison outcomes. Lynn already discussed this briefly, and I'll go into a bit of detail on this later on. So I'm just going to leave that for a second. So next is the search strategy. And searches for overviews are typically simpler than searches for systematic reviews. That's because if you're doing a Cochrane overview that only includes Cochrane reviews, you only need to search the Cochrane library. So you only need to search one database. It's also helpful to contact relevant Cochrane review groups just to ensure that you haven't missed any relevant reviews in your search. They're often very helpful with that. So next is screening and inclusion, which is also not as complex as for reviews, because typically we have less reviews to screen, and typically we're only screening for the population. So the most important thing for us is to make sure that the review is looking at the right disorder and the right age group, and any other factors you've pre-specified as important factors. So screening for the intervention, comparisons, and outcomes typically depends on the overview. Normally we want to be more inclusive at this stage, but of course there are exceptions. So we did one overview on non-pharmacological treatments for ADHD, and that is a good example of when you want to screen for the intervention. We only wanted non-pharmacological therapies for that one. So I do have a question for you now. As you know, the Cochrane database includes many reviews that are currently at the protocol stage and that haven't yet been published as a full review. So my question to you is, should you include these protocols in your overview? And you can just answer using the check mark and the X that are on the left of your screen. So I'll give you a few seconds to answer now. I see some of the answers are starting to come through. All right, I'll just give another few seconds for any last answers that are coming in. All right, so I'm going to publish the answers that you guys provided. So from the answers that we did get, you can see that it's split pretty half-half. So overall, the consensus seems to be, I'm not sure. And there's actually a very good reason for that. It was kind of a trick question that I gave you, because the answer to this is both yes and no, depending on the situation. So it's always a good idea to contact the relevant Cochrane review group if there are protocols that meet your inclusion criteria. Ask them if the reviews are close to completion, and often they won't be, but sometimes they will, and we found that authors are really very happy to provide pre-publication versions of their reviews with us. Actually, we found that sometimes our best data comes from these pre-publication versions. So to answer the actual question, it doesn't do much good to include protocols, but if you can obtain pre-publication versions of these reviews, then you should include them. Otherwise, you can exclude them, and at least you know that you covered all your bases and you attempted to obtain all relevant reviews. So once you have your clinical question, your included reviews, and your outcomes of interest, it's time for data extraction. And this is what I'm going to focus on for the rest of my presentation. I'm going to talk about 3 different types of useful data, different ways to present this data in overviews, and potential issues that we often encounter in data extraction. So the first type of data that we have to talk about is information about the included reviews. So this is something that's unique to overviews that you don't have to consider in systematic reviews. And we found that this information is best captured in a table format. So there's various types of information that you need to extract for this. You want basic review information, so the title, authors, and the date last assessed is up to date. You want to include the number of included studies in the review, as well as the pooled sample size of the studies. And it's also helpful to report the size of the smallest and largest trials. Then you want to report your Pico information as well. So I'm going to show you an example of what this table might look like. This is from an overview on non-pharmacological therapies for ADHD, and the arrows here point to the different things that I mentioned on the previous slide. So in the first column, you have your basic review information. That's followed by your study and participant ends. And then in your next 2 columns, you have your population information. So first column is age ranges, and second column is definition of disorder. And then that's followed up by recording information about the interventions, the comparisons, and the outcomes. But we do also need to present information about the included reviews in text as well. And we also need to present information about the studies that are included in those reviews. So typically this is done in 3 sections, and I'm going to talk about each of these 3 sections briefly. So the first section is called the Description of Included Reviews section. And I would like to pose everybody here a question. So for the Description of Included Reviews section, what kind of information about the reviews and their included studies do you think would be important to include in this section? So I invite you to use the chat room to type out your answers, and I'll start reading them as they come in. So again, the question was, what kind of information about the reviews and the included studies do you think is important to include? So we have a few answers coming in. Sally says that we should include information about the study designs of the included trials. That's definitely very important to include. And we have a good handful of people writing, so I'll wait for answers to come in. Andrea says we should include the date that the reviews and the trials were last updated, and that's also very important. Ahmed says we should talk about the population, the interventions, the comparators, the outcomes, again the study design, and the date of the search. Joey Kwong says study size and duration of the study. Those are definitely very important as well. Participant 1 is saying that we should include information about the quality assessment, and that is something that we will talk about in a bit of depth later on. That's definitely important. And I'll just wait for one last answer to come through. Trevor says the quality of the studies in the review. So again, that's something that we'll talk about fairly soon. And I think there's one more answer coming in. Oh, no, maybe there's not. Okay, so thank you everybody for your answers. Everybody provided some really great answers. There's no real wrong answer here. It's great to include more information rather than less. So I'm going to talk briefly about what we've come up with and what we found is important to include. So a few of you mentioned some basic review information, and we did just talk about that in the last few slides. A lot of you talked about trial information, so the number of trials, the study designs, a few people mentioned that answer. Also the location of the trials, and the length of the trials, and also follow-up. Another important one is the search strategies of the reviews. So this is important to include because we want to know which databases the different reviews searched and whether or not they were the same or different across reviews. So this helps us determine whether the searches were comparable or not. We also want information about the participants. So we had an answer that focused on this. Just to be a bit more specific, we want information about participant ages, demographic information, information about the disorder, and it's also really important to note how the disorder was defined in the different reviews, because sometimes reviews will define the same disorder differently. We also want to note information about the disease severity. In terms of interventions, this was also mentioned as an answer. We want to know how many interventions are included in the overview and which ones they are. We want to know how many trials looked at each of these interventions. And we also want to know the dosages and repetition schedules. So for outcomes, again, we want to know which outcomes. And we want to know whether these outcomes are similar or different in the different reviews. Another important one is how were the outcomes defined? Were they defined the same or differently across reviews? And when were the outcomes measured? And then, of course, there are a variety of other answers that might be applicable here depending on the specific requirements of your review. So now, as a lot of you mentioned, you talked about reporting the methodological quality. So we will move on to examining methodological quality of included reviews. This is also something that's unique to overviews, and we haven't started assessing this until recently. And this is because in the past, we more or less assumed that most Cochrane reviews were high quality, and there was also no validated measurement scale to measure this. So now that we've done enough overviews to really begin refining the methodology and exploring these types of areas, we're starting to experiment. With this, and we've done this using the ANSTAR tool, which stands for Assessment of Multiple Systematic Reviews. This tool assesses reviews on 11 different criteria. It is a bit tricky to use, and the tool is in the process of being refined, but it seems to be the best option we have so far. So if you're interested in assessing the quality of your reviews, that might be an option for you to consider. So the next section that we're going to look at, which again a lot of people mentioned in their answers, was the methodological quality of included studies. It's definitely important to report this in your overview. And in reviews, in different reviews, trial quality has already been assessed by the reviewers. And we found that reviews often use many different tools to do this. So some reviews will use the full Cochrane risk of bias tools. Others will use partial risk of bias, so they'll only assess some dimensions. Others, again, will use only allocation concealment. And then there are some reviews that use completely different tools, like the Haddad tool. And we have seen a few others used as well. So this brings up the question then, in an overview, how should you present data on the methodological quality of the included trials, especially if the reviews are using different tools? So again, this really depends on the overview. If it's possible, you should report the quality assessments that are presented in each review. We've actually been able to do this almost all of the time, even though it does sometimes get a little bit messy, and it does sometimes take some creativity to determine the best way to present this information. However, sometimes it's just not possible to report on what's in the reviews for a variety of reasons. So in these cases, it's a good idea to go back to the original trials and re-extract the quality assessments yourself. One advantage of this is that you often end up with a cleaner end product. Okay, so that brings us to the third type of data that we need to discuss, which is quantitative data. So this is our effect estimates and our outcome data, and we usually present this data in results tables and in a section of text called the effects of intervention section. So I'll be talking about both of these, as well as some of the issues that are related to data extraction. So for the results tables, like Lynn was saying earlier, it's good to present this data by outcome, not by intervention. We typically don't present forest plots and overviews. That's because it's easy to imagine how this could become really big really fast, and we don't want to overwhelm the readers. So we present the results in tables instead. And I'm just going to give you an example of a results table. So this is an example of a table that we included in our overview on bronchiolitis. In this case, we decided to do 3 separate tables. You'll see here that this table is looking at outpatient outcomes, and we also had 2 other tables for inpatients and ICU patients. So in this table, all of the outcomes are presented in the first column, and the comparisons examining these outcomes are in the second column. Then we also have data about the number of subjects, the number of studies, of course your measure of effect, and your I-squared to measure heterogeneity. And another note is that we also present significant outcomes in bold, just because that makes them easier to pick out of the table. So next I'd like to talk about issues related to data extraction. Before you begin extracting data, you want to make sure you know what outcomes you're extracting. You want to choose fixed or random effects modeling. And for your dichotomous data, you want to choose whether you want to present these as risk ratios or odds ratios. So for the actual data then, you'll typically need to re-extract data. And you can do this pretty easily using Review Manager. The reason for this is that it's likely that some reviews will use fixed effects when you want random effects in your overview, or they'll present odds ratios when you want risk ratios, or the information just won't be presented in a format that's useful for you. So I'm going to talk about 3 different questions that might come up when you're extracting data from reviews. And this first question, which I would like to pose to the group, is should you go back to the original trials to extract additional outcome data? So again, on the left-hand side of the screen, you can either use a check mark or an X to indicate your choice. I see there's a few answers coming in already, and I'll give you a moment to make your answer. Again, the question is, should you go back to the original trials to extract additional outcome data? So we have a lot of answers coming in, and I'll just leave this for another moment. All right, so here is what we ended up with. As you can see here, most participants in this chat room today think that we should go back to reviews, or to the original trials. And actually, this question isn't as straightforward as we would think. We have found over the years that there actually is no definitive answer here. The child health field does typically avoid this, but there are some instances when we find it absolutely crucial to go back to the trials and extract additional data. So I've included two examples for you here from recent overviews where we did go back to the trials, and you can read over those if you want, but I just wanted to provide examples of when we have found it crucial to go back to trials. So my next question for you is, what do you do if a review contains mixed child and adult data? Again, this is the child health field, and we're interested in examining the effects of interventions for children. We're not looking at any other populations. So the question is, what do you do if a review contains mixed child and adult data? You can make your selection in the same place where you looked for your yes/no answers. And I see a few answers coming in. There seems to be a pretty consistent trend here. I'll just give it another second. Okay, and let's look at these results. So, out of everybody that answered, it looks like overwhelmingly you guys are thinking C, try to extract the child-only data, and that is actually the right answer. And I'm just going to take a second to explain why. So answer A was do nothing, extract all data. That's incorrect because this would involve extracting data that's not relevant to your clinical question. You wouldn't do this in a systematic review, so you shouldn't do it in an overview either. Answer B, exclude the review from your overview, is also not correct because then you'd end up excluding relevant data that's useful to your clinical question. So like almost everybody here indicated, C is the correct answer, extract the child-only data. So if there are trials that include adult data only, that's easy, you exclude those trials from your overview. And actually that's the same with trials that include mixed adult and child data, unless the review provides information about the child-only data separately. Unfortunately, we found that this is pretty rare, so we do end up excluding most mixed trials. So that leaves us with the child-only trials, which we include in our overview. So now I'm going to walk you through an example of how you would go about extracting this child-only data in your overview. But remember again that this can actually apply to any population that you're interested in versus any population that you're not. So if you're interested in data from outpatients only and you don't want inpatient data, you can apply the same sort of techniques here. So this is a meta-analysis that was taken directly from a review examining antibiotics versus placebo for the common cold. This review was included in our sore throat overview, and the outcome that we're looking at here is adverse effects. And of course, we're interested in the child-only data. So as you can see, the first 4 trials here included mixed or adult data, which we did not want included in our overview. And the last 2 trials included children only. So the last 2 trials, that's what we want to include in our overview, and that's what we're going to re-extract. So we're going to do this by taking the data that's circled here and re-entering it into Review Manager. Okay, so after re-extracting the child-only data, which is what I've done here using Review Manager, we end up with a point estimate of 0.81. And this value is the one that we want to include in our overview. And I'm going to show you right here the adverse events table that we included in our sore throat overview. And the outcome that we just extracted is highlighted in orange. So that's one example of how to extract data from only the population that you're interested in. And I do want to make a special note here that just because the review didn't present the child-only data separately, that doesn't mean that we can't use it in our overview. So overviews are not just an exercise in transcribing numbers. They're much more complex, and they sometimes do involve substantial reanalyses. So then, my third question to you is it okay to split and combine the meta-analyses in the included reviews, or should you always present the data in your overview in exactly the same way as it's presented in the reviews? And we did just discuss this. The answer to this is yes, it's definitely okay to do this. The child-only data, the example that we just saw, is one example of splitting out some data. And by splitting, what I mean is using only certain trials from the meta-analyses. Combining data would be the opposite, so that involves taking data from two separate meta-analyses and combining them together into one. So since we just saw an example of splitting out the child-only data, now I'm going to give you an example of what it would look like to combine data together. So this meta-analysis is taken from a review that we included in an overview on eczema prevention. It looks at prolonged feeding of hydrolyzed versus cow's milk formula for prevention of any allergic disease. So as you can see here, the review presented data on the incidence of any allergy in infants and the incidence of any allergy in children. But we were wondering, what about the aggregate data? So what about the overall incidence of any allergy in all infants and children? The review didn't present this information, so we re-extracted this data ourselves by combining all of the trial data into one meta-analysis. So we re-entered the data into RevMan, and as you can see here, we ended up with a point estimate of 0.73, and this point estimate is what we included in our overview. So again, highlighted in orange, you can see our estimate of 0.73, and you can see the outcome table that we included in the overview. So does that make sense to everybody? If you could just use your happy face or your sad face to indicate if that makes sense, that would be great. All right, so it looks like that did make sense to a lot of people. That's great. So then, now that we've addressed some of the common issues that are related to data extraction, and now that we have extracted a little bit of data, I'm going to move on to the last thing that we have left to discuss today. So that is presenting all of this data in text in the Effects of Intervention section. So very quickly, again, we want to organize this section by outcome, and we want to present all data on all interventions for one outcome before moving on to the next outcome. So, and last of all, in this section, we want to finish by presenting adverse effects data. Even if the reviews didn't report on adverse effects, it's always a good idea to even just say that. So that's everything I have to talk about today. If you want to learn more about overviews, methodology, you can look at the Comparing Multiple Interventions Methods Group website, or you can refer to the Cochrane Handbook. There is an entire chapter dedicated to overviews of reviews. And if you want to read some of the completed overviews that the child health field has done, you can go to the Evidence-Based Child Health website. You can try using the link below, but you might have to log in through your university library account and then go to the website that way. So then, I guess we have a few minutes left for questions, either for Denise, Lauren, or myself. So does anybody have any questions? If you have questions, you can either raise your hand to speak, or you can type your question out into the box.
Okay, we have a couple of questions that have come through, so I'm just going to read them and then I'll pass the microphone over to Michelle and Denise. The first one is if you could answer what is an intervention review. The second question relates back when you were discussing protocols. Could the protocol be assigned as, quote, awaiting assessment or, quote, ongoing, as a signal to some information that may be available for the future update of the overview? Michelle and Denise.
It's Lauren. Actually, I'm the one that mentioned intervention reviews, so I can address that. By intervention review, I mean the standard Cochrane review. We now have 4 different types of reviews in the Cochrane database of systematic reviews. Most of them deal with interventions. Some of them deal with diagnostic test accuracy. There are a small set of methodology reviews, and then there are overviews as the 4th kind. So by intervention reviews, I meant the first category.
Okay, so Michelle and Denise, if you could answer the question regarding use of protocols, that would be great. And you can just scroll back up into the chat room. I can repeat it again. Could the protocol be assigned as awaiting assessment or ongoing, as a signal to some that information may be available for the future update of the overview?
Yeah, that's a great question. Actually, even though we don't include unfinished or unpublished protocols in our overviews, we do make a note that these protocols are in progress. And often, we do go back to our overviews if there were a lot of protocols in progress. And we update them once all of these protocols have been published. So that's a great way of capturing data on a lot more interventions.
We had another couple of questions come through. The first is, do you consider an overview of reviews a systematic review of systematic reviews? And secondly, how does one choose topics for overview reviews?
That's a great way of referring to an overview, actually, and that is the easiest way that I define overviews to other people. Is they basically are systematic reviews of systematic reviews.
And Denise here, I'll just answer the question around how we choose the topics for our overviews. As I mentioned at the outset, as we've picked up a few times, because we are the child health field, we're looking for topics that are relevant to child and adolescent health. So a lot of our search for topics is based on questions that come in from our advisory board, our editorial board, and sometimes too it's talking to review groups. They'll sometimes contact us and say, hey, we've got this really interesting suite of reviews. And so it's a variety of ways. But basically what we're doing is looking for important areas in child and youth health that, and then once we've identified the topic, we check and see what the number of reviews is.
If I can just jump in on both of those questions, I do consider an overview a systematic review of systematic reviews, but I think we're fairly early in developing the methodology for that systematic approach. And that's one of the things the Comparing Multiple Interventions Methods group is going about trying to do. So yes, it's systematic, but probably, as with overviews, the methods have changed over the years. I expect over the next 10 years the methods for as regular systematic reviews and methods have changed, I expect over the next 10 years the methods for overviews will change. In terms of choice of topics, the evidence-based child health process has really been driven by what's in the Cochrane library about health problems related to children, which is a good way to pick topics. I think increasingly, as overviews are produced by Cochrane review groups, we're going to see the process reflect what are the high priority clinical questions, and to some degree, as with any systematic review, what are the interests of the authors, and which topics do they find that they would most like to spend their time on.
We've had another question come through. Do you include non-Cochrane reviews in overviews?
That's a really great question, actually. And recently, in only the past year or so, we have conducted our first overview of reviews that includes non-Cochrane reviews. This is the one on eczema prevention that I was talking about earlier. There are a lot of additional issues that we encountered with this. So we did start off kind of easy. We worked with a group that already had a database of all systematic reviews on eczema prevention. So this kind of helped our search strategy, which would have been huge otherwise. And again, there are a lot of additional issues that come up with that. So for example, what do you do if a Cochrane review and a non-Cochrane review look at the same intervention? We tried to make decision rules that were as simple as possible for these types of questions. And we do think that it worked out well, but this is a very new area in overviews, and I expect that we'll see the methodology being refined in this area as the years go on.
That's great. So are there any other questions at this time? Again, raise your hand or just type it into the chat room. Thank you for your contributing to the discussion so far. It's been a great session. Okay. Well, I will bring things to a close. Please join me in thanking Lauren, Denise, and Michelle for their presentation today. And again, I want to thank all of you for joining us today and contributing to the discussion. In just a moment, I will send through an evaluation form. If you could take a moment to complete that and send it back to us here at the Canadian Cochrane Centre, that would be great. The email is provided on the screen and in the evaluation form. Thank you for joining us today, and I will also send a copy of the slides through the interface, so you can just wait, and I'll send both of those items through before you log out. Thank you for joining us. Have a great day.